social distancing both at the policy level as well as the personal behavior level lowers economic activity, as we have seen with lots of the job losses, over 30 million up until May 1st, as well as lowering GDP. But at the same time, the goal of that was to, reduce the amount of cases, infections, and deaths. And so going the opposite direction, of course, means that you can, as you open up the economy, you can get more jobs and recover some of the lost GDP. But at the same time, there's a trade-off with more cases and deaths. What we're projecting at the Penn Wharton Budget Model is that even if states do not change their social distancing, that is, they keep it at the same level as it was on April 30th, just last week. And it's supposed that personal behavior itself is not changing. People are doing whatever they happen to be doing, whether they're keeping 6 feet apart or not, that we still are going to see an increase in deaths between now and the end of June. We project 116,000 increase in deaths, but we'll also see an additional increase in job losses between May 1st and end of June to the tune of about 18.6 million. So that's on top of the 30-some million that were already lost. The first model that really combines the epidemiological model, workhorse kind of model out there with an economics framework. And even if you're only interested in health variables, you really need that economic model, because that's where the social distancing takes place. As companies come back, the social distancing gets reduced. As schools come back, social distancing gets reduced. Of course, we're going into the summertime. We have to be cognitive of that, and the model takes that into account. And so in particular, what we do is we need really precise data, not at the national level, not even at the state level. We actually go right down to the county level and many times the zip code level, where we actually have cell phone location data of counters, of mobility. We have an employee scheduling, payroll data, businesses that are open, how many people are working, even the hours that they're working, unemployment insurance data of initial claims, even web searches for filing, and lots of other data, financial data, even climate data right at the zip code or county level, as well as the labor force characteristics of how old is the population, what is the industry compositions, and are we talking about financial service company in New York? Are we talking about a farm in Wyoming? We need all that information in order to do these calculations in a really fine-grained way before we kind of add up things. Certainly, we have a lot of information at the local level, but you also have people traveling between localities as well, where contagion can kick in. And so the general method that we use is that this is the classic question of social sciences. How do you distinguish between correlation and causation? And so you need to really kind of figure that out. It's really important in this case. And so what we essentially are doing is that, different states armed with almost the same information, they have lots of variation in how they reacted to it. Some states have done emergency declarations, which we find are not particularly that effective. Some states have done stay-at-home orders, school closures, restaurant closures, non-essential businesses, other types of businesses, and so forth. And so states have reacted different ways to this information. And we essentially are able to use this as a natural experiment where we don't just look at the levels of what happened in those states. We actually are looking at the differences of outcomes, so that now we can establish more of a causal effect. And that's what we're using to actually do the analysis and figuring out what are the likely effects associated with a policy relaxing, as well as people changing their own behavior. What we expect to see is probably more policy relaxing that's happening. And we will expect to see deaths go up. Now, even without the policy relaxing, the deaths will go up simply because of that there's an ongoing virus and you don't have a perfect lockdown. There's always going to be some transmission, even with the current policies. But then, as we start to see policy relax, we could also see behavior relax, where there are things I can do within the existing policy to reduce my personal social distancing. I maybe don't stand 6 feet apart from the nearest person. I'm not wearing a mask. I'm not doing maybe I'm getting together with groups of friends that really increase contagion. So depending on those interactions, you can get radically different results. And so that is really the goal here, the Penn Wharton Budget Model Simulator, is to really try to understand those results as a condition, not just a policy, but ultimately of personal behavior. And we're talking about potentially hundreds of thousands of deaths that are different between the different policies and personal behavior. What the model takes into account is certainly you have differences in density of the population. New York is obviously much more dense and therefore contagion much more severe in more dense places. But you'll also have policy differences as well, and when those policies came into effect. And so, and then you have norms that are different. In particular, just personal behavior could be very different between, say, a Manhattan as well as even other boroughs in New York versus New Jersey. And so, all those factors really matter in this. In particular, just simple correlations are not going to, work in trying to understand the analysis. We really need to use, serious statistical methods to try to really tease out this kind of more natural experiment of why states are actually different in the response. In fact, it's these differences that allow us to identify the causality of things rather than just looking at correlations. If every state was armed with the same information, took the exact same action, and had the same outcomes, then we would not be able to truly distinguish causal versus correlation. We don't think it's going to be, instant rebound in the second half. We think this will stretch out into 2021 in terms of the economics. And so if you disagree with that, one thing you can do is you can go to the Penn Wharton Budget Model website, and we actually have a short run kind of simulator, and to try to make it simple to use for people, we don't use all the technical language that is often common with short run time series econometrics and all that jazz. Instead, what we do is we say, we know there's 3 or 4 main variables that really drive how fast the economy returns. And things like labor market conditions, business input costs, and so forth, and as well as consumer confidence. And we tell the user, put in your values that you think of how today corresponds to 2008 in those general categories. And then we can, based on those, say, okay, here's likely scenario. What's U-shaped or, V-shaped, or if, heaven forbid, L-shaped, which is closer to 2008. And so but our view is that the economy is going to take until 2021 to kind of mostly come back. But there's also, so now we can then look at the CARES Act and say, what's the incremental change from the CARES Act? And what we found is that it will add about 5% GDP this year. And that's pretty significant. Keep in mind, we're starting at a negative number in terms of a reduction in GDP. So we're going to reduce some of that negativeness. In the long run, though, because of the additional debt and other incentives in there, it'll actually lower GDP by about 0.2% by 2030. And now some people will say, what's the big deal? You get 5% today, you lower it by 0.2% in the future, but that's like a permanent lowering, and that's happening year after year after year. Potential GDP is actually being lowered by this. And so as a result of that, policymakers will certainly want to revisit some of the debt issues that are creeping up from this to try to, not have that permanent effect taking place. We're going to kind of feel the pain of the short run effects, much in the same way of we did with 2008, whether or not we have a quicker recovery than we did in 2008. We are projecting that will be a quicker recovery. 2008 did not get back to potential GDP depending on how you mark it, between 7 and 10 years. I mean, it was much more of an L-shaped recovery. But so we are not projecting it's going to be that protracted. At the same time, if you really just try to pile on the debt, even at low interest rates for government borrowing rates, you're going to have an impact on capital accumulation that the government's household saving international capital flows that otherwise would have gone into productive capital will now, a lot of that will go to afford immediate consumption today in the form of government debt to support immediate consumption. That means that there is a trade-off in the future. I mean, the bill has to come due, and it'll come due. It will mean future generations face a larger tax bill. They also face a weaker economy to pay that tax bill.